The world is bright, save your sight. Well, glaucoma is often a genetic degenerative disease, but that doesn't have to mean losing your sight. Let's welcome back Dr. Betsy Fraser, Doctor of Optometry at Compass Vision Care. And, you know, glaucoma is something that's pretty common these days, but I didn't realize that there are things that you can do to prevent loss of sight.
Absolutely.
Yeah, tell us more.
Yeah, so glaucoma is one of those diseases that we're all at risk for as we age. And, you know, honestly, there's really not any prevention, but as long as you're going in and seeking annual comprehensive eye examinations, we're going to be able to determine if you're at risk. It's very treatable. Yeah. So, you know, there's really no reason anybody should lose vision from glaucoma if you're doing your part in getting your eye exams, we're doing our part in doing all the proper testing.
And from what I read, about 90% of people, I think, that go untreated end up losing their sight. So
absolutely. I mean, it is a blinding disease,
yeah.
or it can be, I should say. And so I tell my patients all the time, listen, you know, this can be blinding, but with our technologies and with our treatment modalities these days, there's no reason anyone should ever lose vision from glaucoma.
I want to talk about those treatments, but what about the reasons why one gets glaucoma? So you say pretty much everyone is susceptible to it. What are the causes?
You know, it's a lot of the same with many disease states. So if you are not doing your part in a healthy body, then you're elevating your risk for multiple diseases, including eye diseases such as glaucoma. So, you know, healthy lifestyle, genetics certainly play a role. So if there's a family history, you know, absolutely, you know, that's going to elevate your risk as well.
And what is it exactly? So we talk about glaucoma, but what is it exactly?
So it's a disease of the optic nerve. The optic nerve is what brings all of our blood vessels into the back of the eye, controls our side vision. So somebody who might be suffering from glaucoma is going to lose their peripheral vision or their side vision first. And so that's sort of the tricky part, is that there really are no symptoms. There's you know, vision loss would be more end stage. So, you know, the trick is early detection for those symptoms.
And just going for regular eye exams, and you would be able to tell if someone was starting to suffer from glaucoma without them even realizing it.
100%.
Oh, interesting. So if you have, say, heart disease, high blood pressure, diabetes, things like that, that can also contribute to it worsening? Yeah,
absolutely. I tell, you know, patients too, it's sort of like sick body, sick eyes. And there's so many ways that retina and, you know, the eye can break down, and glaucoma is one of those.
Once someone starts exhibiting those symptoms, so you lose your peripheral vision, is that reversible?
It's not.
Oh, okay.
Right. So I'm sure there are people doing research on how do we regenerate nerves, but we're not there yet. So the goal is early detection and trying to prevent that before vision, you know, is ever lost.
So what treatments are out there? So if someone is starting to lose their vision, what can be done?
You know, there's a lot of different treatments. There's a lot of different types of glaucoma, and so it can be tricky, but most commonly the pressure inside the eye is elevated, and that's what causes damage to that optic nerve. So typically we're using drops to lower the eye pressure to help that pressure stay at a good baseline for patients, so then damage does not occur to that optic nerve. So first line eye drops at this point still.
What about laser?
There are some laser therapies. You know, certain types of glaucoma, you might be a better candidate for something like that.
And does it typically occur in someone who's aging, or can glaucoma present itself in young people?
It can. There can be congenital glaucoma, which is why it's always important to start early with eye exams as well. But typically it affects aging population more often.
I see. Okay. So the best thing is to make sure that people go to the doctor, get their eyes checked on a regular basis, and you can do your very best.
Absolutely.
All right. Thank you so much. Appreciate it. We're back after this.